Fire safety, evacuation, and emergency preparedness serves as the foundational title for this comprehensive training program. This course is designed to provide healthcare professionals with the critical knowledge and skills necessary to manage fire-related emergencies within a medical facility. We will explore the specialized protocols required to protect life and property in complex hospital environments. Understanding these principles is not just a regulatory requirement, but a fundamental aspect of patient care and institutional safety. Throughout this presentation, we will examine the specific hazards present in clinical settings and the structured responses needed to mitigate those risks effectively. This introductory phase sets the stage for a deep dive into the technical and practical aspects of fire safety management. The table of contents outlines 10 distinct lectures that comprise this curriculum. Lecture 1 covers the Introduction to Fire Safety and Emergency Preparedness in Hospitals, providing a baseline understanding. Lecture 2 explores fire science and types of fire in healthcare facilities, detailing the chemistry of combustion. Lecture 3 focuses on fire hazards and risk assessment in hospitals to identify potential dangers. Lecture 4 examines hospital fire detection and alarm systems, which are critical for early warning. Lecture 5 discusses firefighting equipment used in hospitals, such as extinguishers and hoses. Lecture 6 details fire prevention practices in healthcare settings to stop fires before they start. Lecture 7 addresses hospital evacuation planning and patient movement, focusing on logistics. Lecture 8 covers emergency response procedures and code red protocol for immediate action. Lecture 9 emphasizes fire drills and staff training in hospitals for practical readiness. Finally, Lecture 10 discusses post-fire safety, recovery, and hospital continuity planning to ensure the facility returns to operation. Section 01 introduces the core concepts of fire safety and emergency preparedness in hospitals. This section serves as the starting point for our detailed exploration of how healthcare environments must be secured against fire threats. It emphasizes that hospitals are unique environments where traditional fire safety must be adapted to meet the needs of non-ambulatory patients and complex medical infrastructure. By establishing a strong foundation in these introductory concepts, staff members can better appreciate the life-saving importance of the technical protocols discussed in later modules. This chapter bridges the gap between general safety theory and the specific practicalities of a high-stakes medical setting. Lesson 1, Lecture 1, focuses on the importance of fire safety in hospitals. Patient life protection is the primary goal, as fire safety practices help protect vulnerable patients from injuries and life-threatening situations who may be unable to help themselves. Staff and visitor safety is equally vital, ensuring that proper fire prevention measures keep healthcare workers and visitors safe throughout the facility. Hospital property protection is the third key pillar, as fire safety reduces damage to hospital buildings, expensive medical equipment, and critical infrastructure. Protecting these assets is essential for the continued delivery of healthcare services to the community, even after an incident occurs. Each of these elements works together to create a secure environment for healing and professional practice. Lecture 1, Section 1.2, details the unique fire risks in hospitals that distinguish them from other buildings. Oxygen system hazards are a major concern because oxygen and medical gases can significantly intensify fires if leaks occur in the piping or delivery systems. Electrical equipment risks are also prevalent, as the high density of medical devices and complex electrical systems may cause fires if they become faulty or overloaded. Additionally, the flammable material presence, including alcohol-based sanitizers and various clinical chemicals, increase fire hazards significantly. These materials are essential for hygiene and treatment, but require careful storage and handling to prevent them from becoming fuel sources in the event of an ignition. Understanding these specific risks is the first step in effective hazard mitigation. Section 1.3 addresses patient safety during emergencies, highlighting the challenges of a clinical environment. Limited patient mobility is a critical factor, as many patients cannot move independently during emergencies due to illness, sedation, or physical disability. Because of this, assisted patient evacuation is mandatory, meaning staff may need to assist patients using wheelchairs, stretchers, or specialized carry techniques to reach safety. Priority patient protection is another essential protocol, where critical patients, such as those in intensive care or surgery, require special attention and specific clinical support during fire emergencies. Managing these various levels of patient needs requires pre-planning and a calm, organized response from all healthcare providers on duty. Section 1.4 outlines the specific role of hospital staff during a fire event. Safety procedure awareness is the first requirement, as all staff must thoroughly understand hospital fire safety procedures before an emergency occurs. Immediate hazard reporting is a proactive responsibility, where staff should report fire hazards, such as blocked exits or frayed wires, immediately to prevent incidents. Finally, the patient assistance responsibility dictates that healthcare workers must guide and support patients during evacuations, acting as leaders to ensure everyone reaches the designated assembly points safely. Staff members are the front line of defense, and their ability to execute these roles effectively can make the difference between a controlled incident and a tragedy. Section 1.5 concludes with the importance of emergency preparedness through structured planning. Emergency response planning is essential, as hospitals must create clear, written emergency response plans that account for all possible scenarios. Regular staff training is the mechanism that brings these plans to life, helping staff respond correctly and instinctively during the high-stress environment of a real emergency. This leads to improved emergency coordination, where prepared staff can coordinate each other and with external emergency services during incidents. By investing time in preparedness, the hospital ensures a synchronized response that minimizes confusion, reduces reaction times, and ultimately saves lives and preserves the facility's ability to function.